Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is radiofrequency ablation for back and neck pain treatment. Here's a few facts on back and neck pain. Back pain affects 90% of Americans at some point. It's the second most common reason people see a doctor behind the common cold. It's a leading cause of disability in those under the age of 45, and up to 40% of those who undergo back surgery end up with failed back surgery syndrome. Neck pain affects about 10% of the population at any point in time, and that's up to 45% each year. When you look at the facet joints of the neck and the back, they're about the size of a thumbnail. They're on both sides. They do have cartilage. They provide a lot of motion for the spine. They're also prone to arthritis just like other joints. 45% of the time, they're the cause of neck or back pain. And there really is no successful joint replacement for these facet joints. To make the diagnosis of facet joint arthritis entails a combination of history, physical examination, imaging studies, and possibly a diagnostic exam injection such as a medial branch block. Here you see facet arthritis. This actually has no arthritis. Look how nice and smooth that joint looks. But if you look at it here, it has bony overgrowth. It's hard to make out the joint line. So that patient may have no pain whatsoever. It doesn't necessarily correlate with what you see on the imaging studies. So it can end up being a coin toss. Severe pain may be accompanied with very little arthritis in imaging studies or vice versa. Even the best trained spine doctors get it wrong about half the time. So as mentioned, the diagnostic injections with a medial branch block or a facet block can be very helpful. Steroid medication and numbing medicine into the joint. Medial branch block, it goes around the joint and deadens those little nerve endings that supply sensation to the joint, called the medial branches. So if you have a positive result from the diagnostic injections, some say 50% pain relief, some say 80% pain relief, some say 80% pain relief on two separate occasions, then the indication may be there to have a radiofrequency ablation. The medial branch block in and of itself can provide pain relief for 3 months on average. And when it wears off, you can either repeat it or go on to the radiofrequency ablation. Now, radiofrequency ablation is also called radiofrequency neurotomy, medial branch neurotomy, medial branch thermocoagulation, denervation, lesioning. All these, they mean all the same thing. So here's 5 facts. The current used in the procedure is the same wavelength as radio signals, but there's no FM radio involved. It can be more painful afterwards and before it gets better. Pain relief can last for upwards of 2 years. You do need to have the diagnostic injection beforehand, like I showed you, and it's been a revolutionary treatment in the 21st century for back and neck pain. Well, what exactly does an RFA do? Well, just to be clear, RFA is radiofrequency ablation, and what it does is it doesn't affect the nerve roots, okay? That you want to stay away from. But the little nerve endings that come off of that, the medial branches, that's what it burns, okay? And deadens those little nerve endings that are causing pain, and that's how you get the pain relief for 6 to 24 months. The procedure involves catheter placement under fluoroscopy, which is real-time x-ray. The newest machines allow up to 4 joints to be treated at one time. So you have 4 catheters here being placed. And the pain doctor will put the needles where they like it and then do a slight stimulation of those to make sure a leg or an arm doesn't jump. Because if it does, you're too close to the nerve root and they'll move it because they just want to get those sensory nerve endings. Now, once that's established, usually the catheters are heated up to 80 degrees Celsius for 90 seconds, and that deadens the medial branches. It's an outpatient procedure that takes under an hour. Now, the results can provide pain relief for up to 2 years, significant and longer lasting pain relief compared to steroid injections. It can provide for greater range of motion, decreased use of analgesic pain medication, and a short recovery time. Complications. You can have potential increased pain for a week or so due to spasms prior to relief. May have increased pain for months if a nerve is only partially coagulated. Might have some numbness of the skin over the procedure site. Very rare spinal cord trauma. Average pain relief in one study was 15 months at 472 days. And then if it wears off, you can just repeat the procedure. Studies show you can get the same results. The top non-operative Georgia pain management is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and over 25 treatment options provided by the board-certified doctors. Visit us online today at georgiapainnetwork.com. and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.